Have you ever wondered how the HIV pandemic has impacted societies across the globe? Welcome back to the Victory Education Lounge. And today we're exploring Global Impact of HIV, a Societal Lens, Part 05. Before we dive in, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us create more informative content and fosters a supportive community. As always, let's start with an important disclaimer. The information in this video is for entertainment and educational purposes only. Any health-related decisions should be discussed with a licensed physician. This episode is not just about the disease itself, but the profound ripple effects it has left on humanity. We'll be exploring how HIV/AIDS has reshaped the landscape of our societies, leaving no stone unturned. We'll break down the societal impact of HIV/AIDS into 5 key areas: the strain and innovation within healthcare systems, the economic toll and workforce changes, the persistent social stigma, the shift in family structures, and the global cooperation it has instigated. This comprehensive exploration will help us understand the far-reaching implications of this global health crisis. So buckle up and get ready for an enlightening journey. Stay tuned as we delve into these areas one by one. First off, let's examine how HIV has strained and shaped healthcare systems worldwide. The advent of HIV/AIDS has led to a significant strain on healthcare resources, particularly in developing countries. These regions face a daunting challenge as they struggle to provide care for the growing number of individuals affected by the disease. Many of these countries already grapple with limited resources, and the added burden of HIV has stretched these systems to their limits. Yet it's not all doom and gloom. The HIV pandemic has also led to some remarkable innovations in healthcare delivery and patient management. Faced with a rapidly evolving and complex health crisis, healthcare providers worldwide have had to think outside the box. They've devised new ways to deliver care, manage treatment regimens, and monitor patient health. Mobile health technologies, for instance, have emerged as a powerful tool in this fight, allowing for remote patient monitoring and streamlined data collection. Telemedicine, too, has seen a surge in its application. It has proven particularly beneficial in regions where access to healthcare services is limited, either due to geographical constraints or social stigma. By bridging the gap between patients and providers, telemedicine has made it possible for many to receive the care they need, even in the face of adversity. Community-based care models have also gained traction in the battle against HIV. By bringing healthcare services to the heart of communities, these models have empowered individuals to take an active role in their care. They've fostered a sense of ownership and resilience among patients, leading to improved treatment adherence and overall health outcomes. In a similar vein, task-shifting strategies have been implemented to address the shortage of healthcare professionals. These involve training non-physician health workers to perform certain medical tasks, thereby extending the reach of healthcare services. Thus, HIV has both strained and shaped healthcare systems across the globe. It has highlighted the challenges we face, but has also driven us to innovate, adapt, and evolve in our approach to healthcare delivery. As we continue to combat this global health crisis, we must remember that every challenge presents an opportunity for growth and improvement. Next, we will explore the economic impact of the HIV epidemic. The economic consequences of HIV/AIDS are profound and multifaceted. To truly understand this, let's start with workforce productivity. HIV primarily affects individuals in their prime working years, leading to a significant reduction in labor supply. This ultimately affects the overall productivity of a country, especially in regions where the prevalence of HIV is high. Moreover, the loss of skilled and experienced workers can disrupt businesses and hinder economic growth. In sectors such as agriculture, this can lead to food insecurity, creating a vicious cycle of poverty and disease. Now, let's flip the coin and look at the increased healthcare costs due to HIV. The financial burden of providing care and treatment to those living with HIV/AIDS is substantial. Antiretroviral therapy, hospitalizations, diagnostic tests, and other associated costs can quickly add up. For many countries, especially those with limited resources, these costs can strain national budgets, diverting funds away from other crucial sectors like education and infrastructure. Additionally, the economic toll of HIV extends to households and families. When a family member falls ill, household income can decrease due to reduced productivity or job loss. At the same time, medical expenses increase, pushing many families into poverty. This can have long-term effects on children's education and future earning potential, perpetuating a cycle of poverty and inequality. The economic impact of HIV/AIDS also affects foreign investment. Countries with high HIV prevalence rates can be perceived as risky investments, leading to reduced foreign direct investment. This can limit economic growth and development, creating yet another barrier to overcoming the HIV epidemic. Yet despite these challenges, there are also stories of resilience and innovation. For instance, the need for large-scale, cost-effective treatment has spurred advancements in generic drug manufacturing, particularly in countries like India. This has not only made HIV treatment more accessible but has also strengthened these countries' pharmaceutical sectors. The economic impact of HIV is far-reaching, affecting both individuals and national economies. However, with concerted efforts, strategic investments, and global solidarity, we can mitigate these effects and create a more prosperous and healthier future for all. Now let's discuss the persistent issue of social stigma associated with HIV. This stigma, deeply ingrained in societies across the globe, is a formidable adversary in the fight against HIV/AIDS. HIV-related stigma is a complex issue that manifests itself in many ways. For some, it may emerge as fear or prejudice, for others, as discrimination or ostracism. It's a burden often carried by those living with HIV, but also by their families, friends, and even healthcare providers. This stigma can permeate every aspect of life, from employment and housing to education and personal relationships. The impact of this stigma on HIV testing rates is particularly concerning. Fear of being labeled or ostracized can dissuade individuals from getting tested, which results in late diagnosis and decreased chances of successful treatment. It's a vicious cycle that perpetuates the spread of the virus while also undermining efforts to control the epidemic. Similarly, stigma can negatively affect treatment adherence. Those living with HIV may avoid seeking care or fail to consistently take their medication due to fear of disclosure and subsequent discrimination. This not only jeopardizes their own health but also increases the risk of transmitting the virus to others. But the news isn't all bleak. Across the globe, efforts are underway to combat HIV-related stigma. Various strategies are being employed, from public education campaigns and policy reforms to promoting positive representation of people living with HIV in media and popular culture. These efforts are making a difference. Slowly but surely, the cloak of stigma is being lifted, revealing the human faces of the HIV epidemic. It's a step towards a world where a person's HIV status doesn't define them, where they can seek and receive care without fear of judgment or discrimination. And yet, the road ahead is long. HIV-related stigma is a deeply rooted issue that can't be eradicated overnight. It requires ongoing commitment, not just from policymakers and healthcare professionals, but from each one of us. We all have a role to play in creating a world free from HIV-related stigma. Despite progress, social stigma remains a significant barrier in the fight against HIV. Another critical area to consider is how HIV has affected family structures. This virus has not only claimed millions of lives but also orphaned countless children, leaving them in the care of relatives, neighbors, or even on their own. In some regions, the sheer number of orphans has been overwhelming, creating what's often referred to as a generation of lost children. In addition to creating orphans, HIV has also changed family dynamics in heavily affected areas. Grandparents, who should be enjoying their twilight years, are suddenly faced with the responsibility of raising their grandchildren. Older siblings, too young for such responsibilities, are thrust into the role of caregivers for their younger siblings. The impact on the family unit is profound. The traditional roles are often reversed or altered, with children taking on adult responsibilities and the elderly resuming parental duties. This disruption of the family structure has a ripple effect, impacting the social fabric of communities and societies at large. Also, the emotional toll on these families is immense. The grief of losing parents or siblings, the fear of the unknown, and the stress of survival. These are burdens that no child should bear. And yet, amidst these challenges, there is resilience. Families adapt, communities rally, and children grow up to be strong individuals, often committed to fighting the very disease that has so deeply affected their lives. HIV has reshaped families, leaving a lasting impact on communities. Lastly, let's look at the role of global cooperation in tackling the HIV pandemic. From its onset, HIV/AIDS has been a crisis not confined to a single region, but a worldwide issue that requires a concerted global response. It's been a catalyst for an unprecedented level of international collaboration in health research and policy. The necessity to address the pandemic has broken down barriers, fostering cooperation among countries, health organizations, and research institutions. Around the world, teams of scientists have joined forces, pooling their expertise and resources to better understand the disease and develop effective treatments. But the collaboration doesn't end in the lab. Policymakers and health organizations have also come together to share best practices, creating a global network of information and support. This cooperation has led to initiatives like the Global Fund to fight AIDS, tuberculosis, and malaria, and the UNAIDS 90-90-90 strategy, both aimed at combating the disease on a worldwide scale. This global cooperation has not only advanced our understanding and management of HIV/AIDS, but has also set a precedent for how the world can work together to tackle other health crises. It serves as a testament to what can be achieved when nations unite for a common cause. In the face of HIV, the world has shown a capacity for unity and collaboration that transcends borders. Together we can make a difference in the global fight against HIV. To recap, we've explored the societal impact of HIV/AIDS, focusing on 5 key areas. We've seen how this global health crisis has strained healthcare systems, particularly in developing nations, while also driving innovations in patient care and management. The epidemic's economic impact has been profound, affecting workforce productivity and inflating healthcare costs. We've also discussed the enduring social stigma associated with HIV, a challenge that affects testing rates and treatment adherence. The virus's toll on family structures is evident, with millions of children orphaned and family dynamics drastically altered in heavily affected areas. However, it's not all doom and gloom. The HIV pandemic has also spurred unprecedented international cooperation in health research and policy, a silver lining in a challenging situation. The fight against HIV is a global effort, requiring our collective commitment and understanding. Remember, every bit of knowledge and understanding can help us make strides in the global fight against HIV. As we conclude this part of our series, it's important to remember that while HIV/AIDS remains a significant global challenge, it's also a testament to what can be achieved through global solidarity, scientific innovation, and community resilience. Thank you for joining me in the Victory Education Lounge. If you found this global perspective on HIV/AIDS valuable, please give this video a thumbs up and share it with others who might benefit from this information. Don't forget to subscribe for more insights into health, science, and global issues. Remember, in the fight against HIV, we're all in this together. Until next time, this is Maurice, wishing you health, happiness, and victory in all your endeavors. See you in part 06.